Hey everybody, I'm live again. I'm doing kind of a follow-up from a couple weeks ago when I spoke about, increased stress during the holidays and how, in the holidays we undergo higher amounts of stress. And I talked specifically about, the vitamin and nutrient injection therapy that I'm going to be doing until December 16th. So that's still going on this week and next week. If you want to come in my office in Santa Monica, you can call 424-259-3797. And I'm still doing special offers on the stress response support for the holidays. And it's going to be vitamins and nutrients specific for stress given directly into the body through injections or intravenous or IV therapy. But today I want to talk a little bit more about what is my approach to chronic stress? What is my approach to chronic stress and anxiety? And this is kind of a little spiel that I go through when I talk to patients before they come in, since I do offer free 15-minute phone consultations. But basically my approach to addressing and assessing chronic stress is, I want to look at what can I do to assess those physiological causes of stress. Obviously, I want to address anxiety and stress from all angles. So I always refer for therapy and counseling. I'm always looking at making a referral team if we need to. But being a naturopathic doctor that I am, I'm looking at what are the underlying causes, what are some physiological imbalances that might be contributing to increased stress and anxiety. So my first appointment is 75 minutes, and that's where I go through a full history taking. So we're sitting down and talking about, basically all the information I can gather within the given time. So I want to know about what you're eating. I want to know your lifestyle, obviously where some of these stressors coming from. What is the previous treatments that you've tried? What is, previous diagnosis, family history and patterns. And then, of course, as I probably mentioned, like lifestyle habits and things like that. So it's, again, all the symptom picture that I can gather. And then I do physical exams, of course, because with anxiety and stress, sometimes there can be cardiovascular issues going on. And I'm, as a primary care, my job is to be able to refer when necessary to those specialists. So I do a full intake and a full physical and all the areas that we would want to look at. And then the big piece that makes naturopathic medicine unique is that we look at a pretty comprehensive workup, meaning like we're assessing in a deep level. So I always get routine blood work on all my patients, and that looks at again, keeping in mind we're talking about chronic stress and anxiety. I want to look at blood sugar. High blood sugar or low blood sugar can contribute to symptoms of anxiety and increased stress. I want to look at thyroid function. Again, high or low, mostly high, but high or low. I have a lot of autoimmune thyroid patients, a lot of Hashimoto's in my practice. And so I want to look at the function of the thyroid, very comprehensive look at that. Make sure there's no anemia going on. And then again, it's, we're looking at hints in the blood work, because I look at blood work from a functional medicine perspective. So I'm looking at how are the organs functioning, and I want to look at, I kind of use different ranges than conventional medicine. Instead of a diseased state or a healthy state, I'm looking at optimal, functionally imbalanced, and then diseased. So we're picking up hints of things. We can, not only can we see a disease state, but we can also see hints of dysfunction. So I can see hints of B12, folic acid issues. I can see hints of digestive or gut, function issues. And again, I can see some, hints of immune dysfunction. And then that kind of dictates what specialized testing that I want to get. Again, given what's taken in, then I would order any sort of additional specialized testing. So that might be adrenal test, which is, we talked about a couple weeks ago, is the end organ of the stress response. So that looks at, again, high cortisol, low cortisol. It gives a good picture of what's going on and how can we intervene to appropriately restore that system. And then hormones, women may be experiencing PMS or other hormonal imbalances. Hormones can definitely contribute to moodiness, low tolerance of stress, anxiety symptoms, gut function. So we're looking at maybe some of you have seen there's more and more talk about probiotics. And part of that is, because there's also a lot of talk about depression, anxiety, and stress response and gut flora. So maybe you've seen that on commercials or on newsfeed on your Facebook or something like that. But, even gut flora can contribute to some of this stuff. So if you have low amounts of bacteria or an imbalance in the bacteria in your gut, that can definitely contribute to increased stress and anxiety. The other side of it is, of course, stress and anxiety can also cause digestive issues and, contribute to digestive dysfunction. So looking at how the gut is functioning is really helpful, especially in some individuals who are experiencing gut symptoms. Other things can be done, food sensitivities. I've seen so many different conditions and situations contributing to individuals that it's hard to, say a blanket statement. This is always going on with people dealing with chronic stress and anxiety. But so really, that's my job, is to really assess what is this person's situation, paint the picture of what's going on for them, and address it appropriately. So food sensitivities, and then also genetic markers. There are genetic mutations called SNPs and things like that that contribute to kind of your card that you were dealt, or the card hand that you were dealt, and kind of the genes that you were given that do set people up for struggling a little bit harder with stress and anxiety. Again, epigenetics, meaning we know that our environment contributes to the expression of those genes. So that's where we can go diet, lifestyle, and other factors to help limit those genes expressing themselves. That's kind of what I do is, take an intake on symptom picture, what's going on, lifestyle patterns, diet, additional testing, digging deep. And then I spend a lot of time. I think that's the great kind of benefit of working with a functional medicine doctor or a naturopathic doctor like myself, is that you get a lot of time spent with these cases. So I sit down with the subjective information I've gathered and then the objective information I've gathered and really paint a picture of, what's going on, what are the factors specific to this individual situation, why, what are the physiological causes for them that are contributing to their chronic stress and anxiety. And then, of course, how do I prioritize addressing those and be as broad spectrum as possible, but also targeted and effective. And I do use natural and alternative treatments, but diet is always a piece of that. I'm interested in what's right for you at this time. Lifestyle modifications are always a part of that. And then I use mostly like nutritional supplements that are high grade, professional grade, third-party tested nutritional supplements. And then, prescriptions when necessary. And like I mentioned at the beginning, it's really beneficial to have that, intravenous, the IV and the injection therapy for those vitamins and nutrients kind of in that acute situation as well, and to contribute to nourishing the stress response and nourishing the nervous system on a kind of continued basis. So that's kind of my overview. Thanks so much for listening. I really appreciate it. And of course, if you need to contact me and you have any follow-up questions, I'm happy to answer your questions. I do offer free 15-minute phone consultations. So if you're wondering if this type of therapy and type of assessment is right for you, you can always call my office. It's 424-259-3797, or you can go to my website, which is drjoybotso.com. That's DRJOY, B as in boy, O, Z as in zebra, Z as in zebra, O.com, or email me at drjoy@drjoybotso.com. So thank you guys. Have a lovely Monday evening, and look forward to maybe seeing some of you in person. Okay, bye-bye.